Starting your own practice is hard for many chiropractors. It's riddled with both struggles and successes. But here at the Chiropractic Philanthropist, we make it easy by having chiropreneurs and entrepreneurs share their struggles and lessons learned in life and business so that you don't have to make the same mistakes. And now here's your host, Dr. Ed Osborne.
What is it that trips up your office? Finding new patients, retention, teaching about holistic wellness, or is it patients who can't seem to kick poor health practices? As a business owner, a wellness practitioner, a teacher, a mentor, often an emotional support, as chiropractors, we have a lot to carry. Let Mahalo Wellness carry some of the burden. Mahalo Wellness CBD oil products are the one small change that can change both your clinic revenue and jumpstart your patients' crave to begin healthier living. Try all Mahalo has to offer to determine what is receptive in your clinic. Special pricing on 10-bottle and 20-bottle bundles. Head to mahalowellness.com/collections/TCP-podcast today.
All right, TCP listener. So I have an incredible guest today, and that is actually Dr. Mark Jagger. Doc, how you doing today?
Great. How about you?
I'm amazing. I feel like it's September. I'm getting back into the flow of conversations and podcasts. So I'm excited. You're actually first on the roll.
Awesome. Well, thank you very much. I am honored.
Yeah, I love it too. I love the background too. People can't see this if they're listening to the audio. You've got a pretty cool setup back there with some drums and also guitar. So okay,
I probably won't break into any of that. But.
Well, certainly I won't, because it would be pretty horrible. All right. So for those who don't know who you are, why don't you tell us a little bit about who is Dr. Mark, and then also, how you're quickly becoming someone who is of recognition inside of our profession as well.
All right, great. Thank you very much. So my name is Dr. Mark Jagger. I've been a chiropractor since 2002, an NYCC grad, did York kinesiology before that. So in practice, I guess, getting to where I am now, I've had a rehab practice. I purchased a subluxation-based practice. So I've been into practice pretty much everywhere you possibly could be. And I found that really no way tends to be, for me, better than another. But what I found after a number of years is I wanted to start doing things a little bit different, and figuring out some ways to treat the patients that weren't getting the results that I wanted them to get. So I got very interested in disc patients. And due to some of my own injuries from contact sports and weightlifting over years, I destroyed my own neck, despite the advice of my own chiropractor at the time. I just kept lifting stuff I shouldn't have been hammering away at, and I destroyed my own neck. I ended up with three days a week worth of migraines, which is kind of tough to adjust people with. So I had needed a new solution for myself. So I started to try to come up with combinations of things that would fix me, because I have a very hard time, and anyone in practice and out of practice and ever been in contact with patients knows that, the worst thing is when you can't help a patient and you really, really, really want to. So for me, I just became very kind of obsessed almost with those cases that weren't responding. And so I guess that's where I am at this point in my life now, designing medical devices actually that do things a little better than I could do them before.
Mm-hmm.
So I guess that's.
I love this transition, because it's actually one that I've heard before inside of these conversations, is that subluxation based to over here, and you're really let's say treating discs. And some people might say, or some docs might be listening and going, well, that's there's a big, space between, treating discs and then subluxation, depending on where you sit on that scale. Right. Mm-hmm. But one thing, and I'm just going to pull from what you're saying here in this conversation is, and I've learned from all these discussions with amazing doctors, is to be open. What you Was it when you had the subluxation office, was this something that you expected, 5 years ago, that you would be heading down this path?
Oh, absolutely not. I often tell patients when they ask me about the table, laser enhanced decompression table that we built. I said, you know what, for years, kind of how I got into things is I like taking things apart and putting them back together. So, which actually didn't work so well in Dead Lab, but probably everybody's thankful that it didn't. But I actually, when I was 14, 15, I pulled the engine out of my mom's car and put a better one in it. I didn't really know what I was doing. I just started, pulling it apart and figuring it out on the way. So I'd have no problem rebuilding a car, but I would not end up, I wouldn't fancy myself a mechanic, but building the medical device out of the need, I didn't think twice about. So, but 5 years ago, never. No, I never would have thought of being down this road. And it's an exciting road. It's something that, getting into the profession, I never would have seen coming.
Mm-hmm. No. And I mean, again, it's really just, I'm gonna drop this, piece of value from this is just to be open for docs. And
absolutely.
And one of the challenges I had in practice was that, and I've started the process now of actually reinstating my license.
Congratulations. Awesome.
I know, I'm scared.
Oh, that ties into my quote. Excellent. All right.
Okay, perfect. And that's where I'm going right now. Is like, there's you're already dropping some value here. But one of the things we'd love to start with too is just quotes, affirmations, words of meaning. So why don't you drop your quote?
All right, Dr. Ed, going back into practice here, nothing is born without pain. That's a big one. All the struggles, and I mean, every time I changed my type of practice, every time I changed something in my practice, man, it was excruciating. I started a rehab practice because that's what I was kind of educated in. That was my background. I didn't like doing that anymore. I bought a subluxation-based practice because I saw how much fun subluxation-based docs were having. And that was a struggle. I'm like, oh, geez, when does this get easy? It just doesn't, right? And the other one I tie into all the time is the, and it was Jack Canfield, actually, one of your previous guests here, is that everything you want is on the other side of fear. So those two things, I bounce back between those two because, everything is going to hurt if it's worth it. And, you develop and you grow through that struggle. And then all of a sudden you're out on the other side, realizing how many things you learned and how much better you are for that process.
I'm writing some of this. So everything is going to hurt if it's worth it, right?
Yes.
I mean, that's so true. So true. I mean, it doesn't matter if it's in your business or if it's in your relationships.
Absolutely.
It doesn't matter if it's in your fitness. It's going to hurt.
That really hurts.
Even in your nutrition, right? I mean, it all has a certain level of challenge. So I love that. Thank you for that. Okay. So let's talk about some struggle here. Okay. Someone quoted me on this when I saw them. I can't remember, but they're like, don't you say it's like we eat, that struggle for lunch as chiropractors. And we really do. We have the TFL surface for most of us. So tell us about a time where you, as a doc, personally, professionally, or otherwise, when a time that you've had struggle, what you learned from that, and then how you apply that to your life or business today.
Okay. Let's see. Well, we can tie, I guess, personal and business all in together. And the more and more docs that I talk to, and the more and more docs that I hear you talk to, it's a very similar trajectory for almost all of us. So I mentioned I started a rehab practice. I worked for a rehab company. Then I used that to fund starting my own practice, which was more of a rehab thing. And then I saw the fun in subluxation-based practice and what I loved about that. And so I went over to that. And each time was a new struggle with a new business and new things to figure out. The stress, like the financial stress of buying practices and trying to make them successful. We also bought a building at the same time, which was in with the subluxation based practice. The financial weight of that was very heavy. And at the same time, my wife and I were trying to have children, and I found out that I wasn't able to have my own, so we had to find other means. That all together was just it was a crushing weight, quite honestly. I developed migraines like 3 days a week.
Wow.
And with my history of weightlifting in the contact sports, it was partially due to the degeneration. I also have Sherman's, so that doesn't help that only 3 bones in my neck actually move. So, I got to the point where I couldn't bend forward to do a lumbar adjustment without my head spinning and wanting to throw up. And patients don't like when you throw up on them, so kind of had to figure that one out. That's kind of when I got into decompression. So all of those business struggles and the personal struggle along with that, and a strain on relationship, of course, and all that actually got me into decompression. And decompression got me into laser, and decompression and laser got me into building cool stuff. So all of that stuff that I went through, it got me to be able to get to do something pretty cool. Mm-hmm. And now I find, here we had a couple of years where the R&D was very exciting. Now we're ready, and we've launched a little, and now we're ready to launch a lot bigger. And I'm finding myself on this precipice once again, where I'm like, wow, I'm going to have to do some stuff that I haven't done in a few years and actually get real uncomfortable again, probably for another couple of years as we grow this. So right now, where were we at with that? The struggle. It's going to happen every time. Every time you change, every time you try to improve. And if you just stay stagnant, maybe you can avoid the struggle, but you're not going to avoid all struggle. Mm-hmm. There's some you put yourself in, and there's some that, are thrust upon you. But like this Van Halen song, Jump, sometimes you just got to do that. And every time, I'm worried about something and I'm thinking about it, and I turn on the radio, that song's on, like, man, you know what? Somebody's telling me to jump. So that's
little David Lee Roth quote there.
Oh yeah. He's a scholar. Yeah. Not so much a gentleman, a scholar.
But he is a scholar. Yeah. So if we were to say, like, from the time that you really kind of envisioned this to today, how long has that time been for, like, in terms of like the tables and, really just the construction and to where you are at this point today? What's the
it's an overnight success, man. I came up with the idea in 2010. Wow. So we are 2019. We had actually a few sales a few years ago, but we reorganized things a little bit. One of the things we found was medical devices are incredibly expensive to produce, develop, and unfortunately, they're incredibly expensive when you sell them. So, which is a barrier for docs. I mean, especially our profession. There's some cool toys that are very expensive, but they're hard to afford. So, we've retooled things in a way that we're able to introduce a pay-per-use program. Mm-hmm. So, and just basically, because I know these, the way how well the devices work, some of the, the testimonials we get back from some of the other doctors using them, their patients. For me, it's just a massive mission to get them in the hands of as many docs as want to use them, to mm-hmm. get them to as many patients that need them. So we wanted to, reduce the barrier by offering some new programs. So it's been an evolution, really, of just finding the right way to do it. So, like they say, overnight success took like 20 years to happen. Mm-hmm. Well, I think thinking about that, just, in my music history back here, I know guys that toil away for 25 years before they get any recognition, and sometimes that toil away for 50 years and get none, but enjoy doing it.
Right.
So, it's part of that process, and sometimes that process is long.
But quitting will get you nowhere.
Absolutely not. Yep.
Yeah. So
that's the only way to lose, and the only way to fail is to quit.
Right. Is to quit. Yep. Exactly. So, I mean, that's something that I'm pulling from this too, is that, look, I mean, there's so many docs out there who just, at times, they want to give up. We can even circle back on to just be open, Yep. This is something that when I was in practice, and I had, we don't need to go into my story, but I mean, like, when I had a health challenge and I started bringing actually laser into my office.
I remember you talking about that. Yeah.
Yeah. And that was how I was able to scale my business and my efforts. Absolutely. I had a technician who was doing that. Is that something that you're able to do then with your tables? Like, I mean, is that something where you can have someone who applies that, you can scale to a certain degree where you can maybe not even be in the office, but they're doing the treatments for you.
Absolutely. Yeah. Yeah. And that was one of the things with adjusting was every time I took a holiday, I felt horrible, number one. And number two, anybody I had ever cover my office, you come back and no matter how great they were, oh, there was always somebody, oh, well, you weren't here. So this happened and that happened. And I felt guilty taking a holiday, which, is the perfect success or perfect recipe for burnout. So this is one of the reasons I thought about this as well, is to have something that's automated and unattended, essentially unattended, that techs can do. So kinesiologists perform a lot of it. I have some assistants, my physios and other chiros as well. The nice thing about it is the machine does it. So you don't have a situation where the treatment is any different if I hook you up or you hook the person up, or, doesn't really matter. The machine does it the same every time. So yeah, you're absolutely able to scale it, and that takes a lot of load off you as a doc.
And so it's unique in a couple ways too. And like, number one, it's unique because the way that you've structured it so that you can get these tables in the hands of doctors and they can be profitable. But now also it's unique in the way that it actually helps your patients.
Absolutely. Yeah.
So can you tell us a little bit about that? Like, I mean, how is it unique with, like, how does it differ from any other decompression table that's out there?
All right. So, firstly, it's a decompression and automated, like, robotic laser contained. So essentially what we did was put a robot underneath the table attached to run laser programs. Each laser program is specific to diagnosis. So you have not just a cookie cutter thing where the laser does this and the table does that. You can angle the table, you can change the laser program to make it pertinent to the patient's diagnosis. So there's a lot of adjustability in there, which is the main thing that, there's no other decompression table on the planet that does that. So that's the main unique thing with the device. So what was the other part of the question? I'm sorry.
It really comes down to the business aspect. Does that mean that you can you bill more for those treatments versus just a decompression?
We do. Yeah. Yeah. So you can bill, depending on the area, but you can bill more than you can for an adjustment. And depending on how long you take with the patient, you're about 15 minutes. We book them in 20-minute sessions. So you can definitely do more with the billing. The other aspect is too, I always like to say that with any technology, there's that 15% of people that tend to use chiropractors. That number hasn't really changed in the almost 20 years I've been practicing, which kind of sucks. So I think that things like this, I get patients in all the time that show up in my office and like, oh, you're a chiropractor? I didn't want to see a chiropractor because, somebody told me that, I shouldn't see one. But I like this table idea. It seems to make sense. You stretch out the back and you relieve the pain and the inflammation with the laser. I really want to try that. And then after, a couple of weeks in my office, they're like, wow, everybody else is getting adjusted in here. And now I trust you. So I wasn't going to try it, but I think I want to now. So I feel it's a way to get at that population that normally wouldn't consider us. So the tech can get at those people who, I think it can increase that 15% if we can get those people. So that's kind of a big goal for us, is to increase utilization of chiropractors by offering these different services.
Yeah. And let's face it, there's a certain amount of the population that just by saying chiropractic or having that, that they have a preconceived notion of what we do. Yes. And so once they come in and they experience what you do, whether, with a, like decompression, for example, you can build the trust, and then they make, it's an easier transition into a chiropractic patient as well. It makes total sense. And that is the same thing that we did even in my practice.
Yeah.
All right.
I was going to say, and speaking on struggle and your story, especially, the struggles that you went through health wise and all the rest of it, look what it has created. You're helping tens of thousands of chiropractors worldwide, if not more. And that's, I don't want to say it's worth that little bit of pain, but that pain, that pain gave birth to incredible things.
Yes.
So thank you.
Well, I appreciate that. Thank you. All right. So we're going to transition into our basically back to the future. So here's what we're going to do. We're going to actually send you back to your younger self. Okay. This is right after you came out of chiropractic college and you have all the life experience and knowledge that you have today. So you meet that younger self. What would you say to that person?
Run. No. Well, actually, kind of. Get out there and do what makes you happy. I go back to that. Aaron, don't forget to do what makes you happy. Actually, is the big thing. I lost a lot of my hobbies throughout practice the beginning few years. In fact, actually, up until the last year or two, to be honest with you. And I forgot how much I love doing those things. So, don't consume yourself with one thing. Make sure you get out and enjoy and have some balance in your life. The other thing would be that Jack Canfield quote I talked about, everything you want is on the other side of fear. Well, starting a practice was hard, and, I did it and lived. Buying a practice was hard, did that and lived. Coming up with a medical device, the world had never used before, and getting the prototype, that was kind of insane. And, we're doing that. So, that will tie it right back into, the open, stay open, be open,
Yeah, I love it. And if a docs is listening right now and they're like, man, I totally resonate with this story, how can they learn more about you and also more about your tables?
Facebook's one. They can definitely message me. With this type of undertaking, I feel that it's a very personal thing on my side of things, meaning that I would like the opportunity to have some conversations with people. It's a very specific fit of clinic that would work with our program. Docs that are aligning with our, the feel for our goal, getting to that extra population of people. That's one thing. So the website is spinadvanced.com. They can check us out there. But yeah, by all means, Facebook, email is, we could post it up. It's so dr.jagger@spinadvanced.com. So that's probably the best way. The placement program that we're doing is essentially you pay a license fee, and then we do the table on a pay-per-use thing. So instead of having, some of these DRX 9000s, without laser at one point were like 150,000 US. That's a lot of change. So we wanted to add a laser, which is extra technology, but keep the price doable for docs so they can actually, these things are no good if we can't get them in the hands of docs to treat patients. So there's a couple of real good things that we're doing right now. We have a couple in inventory where the license fee, we're actually waiving the licensing fee, and just you preload the table with treatments. And there's a little fee for the training. I come out and do the training as well. So it's about, 30% of what it normally is right now. So, wow. And there's 2 tables to go like that. So we have 2 in inventory. So the next 2 that we place are going to be at a great premium for the doc to get them up and running and flying.
Well, those 2 spots are going to probably go pretty quick.
We look forward to that.
Yeah. All right. So, listeners, you can head over to thechiropracticphilanthropist.com. We're going to have a web page dedicated to our discussion with Dr. Mark Jagger as well. And we're going to have a list and links to all of the resources that he provided and how you can contact him. If you would like, you can actually open your show notes right now on your mobile and check out the links and connect with Dr. Mark right now. All right. So as we kind of wrap up our discussion today, the final question I have for you is a resource. So drop a resource, something someone should listen to, read, someone you're following possibly that everyone should go out and find right now.
All right. So one is this book, Relentless by Tim Grover. That was one thing. And it's kind of along the lines of, not stopping. So I think it's called Good to Great to Unstoppable. That was a great push for me just to, there's times where you think you might want to give up, or that inkling gets into your head. You're like, nope, why you're doing this and keeping your eye on the prize, and keep pushing. So that was about that. The other one real quick, which was kind of a tough read a little bit. It's called Anti-Fragile Things That Gain from Disorder by Nassim Taleb. It was a very talking about systems that actually get better from having stress on them, and I think that is that's the ideal state for humans. I mean, it's the human body for the most part, but it's the ideal state for for your mental conditioning as well. Is take a stressor and have it make you stronger. This is my desired state right now. I'm of the mindset is bring on that struggle because I want to get stronger.
Yeah. I can tell you right now, I mean, there's lots of people who have vision, right? They start projects, but there's not as many finishers. Lots of starters, not as many finishers. So I want to congratulate you and actually acknowledge you for, what you envisioned, actually producing that and getting to the point where you are right now and putting these tables in doctors' hands so they can help more people. So
thank you so much.
Yeah. All right, listeners. So again, you can head over to thechiropracticphilanthropist.com. We'll have links to all of the resources. Dr. Mark, I want to thank you for being on the show today.
Thank you for having me.
Yes, thank you for giving back.
So you've heard the struggles, you've heard the successes, and this episode is done. But there's still so much more to come and so much more to learn. Head on over to thechiropracticphilanthropist.com and sign up for our newsletter, where you'll receive free practice building tips and strategies, including how to market your practice with your very own podcast and so much more. Thanks for listening, and we'll see you next time on The Chiropractic Philanthropist.